Good afternoon, ma'am. I am Ivory Studay from Medical Colleges of Northern Philippines and a nursing student. So, for today, I will administering medication through subcutaneous injection. So, the first procedure is to gather all materials needed, check each medication order against the original physician's order according to agency protocol, clarify any inconsistencies, check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. So, the third procedure is to perform hand hygiene. Then next, prepare medications for one patient at a time. Then, read the medication administration record. Select the proper medication from the patient's medication. Then, check for the expiration date and perform calculations if necessary. Then, withdraw the medication from the ampule. And check for the level. Checking the name and identification number on the patient's identification band. Close the door to the room or pull the bedside curtain. Complete necessary assessment before administering medication. Check allergies. Ask patient about allergy. Explain the purpose of the medication to the patient. Then, perform hand hygiene. Put on gloves. Select an appropriate administration site. Assist the patient to appropriate position for the site chosen. Drape as the needed to expose only the area of the site to be used. Identify the appropriate landmarks for the site chosen. Clean the site with an antimicrobial swab. While whipping with a firm, circular motion and moving outward from the injection site. Then, allow the skin to dry. Then, remove the needle cap with the non-dominant hand by pulling it straight off. Then, grasp grasp and bunch the area surrounding the injection site or spread the skin taut at the site. Hold the syringe in the dominant hand between the thumb and forefinger. Inject the needle quickly at 45 to 90-degree angle. Then after the needle is in place, release the tissue. If you have a large skin fold, pinch up and ensure that the needle stays in a place. As the skin is released, immediately move your dominant hand to steady the lower end of the plunger. Avoid moving the syringe. Withdraw the needle quickly at the same angle at which it was inserted, while supporting the surrounding tissue with your non-dominant hand. Using a gauze square, apply gentle pressure to the site after the needle is withdrawn. Do not massage the site. Do not recap the used needle. Engage the safety shield or needle guard if present. Discard the needle and syringe in the appropriate receptacle. Then, assist the patient to a position of comfort. Remove gloves and dispose of them properly. Then perform hand hygiene. Evaluate the response of the patient to the medication with an appropriate time frame for the medication, and last, document the procedure into the patient's chart. And that's all.